Food aversion, also known as taste aversion, is the avoidance of food with a distinctive taste by an organism. It's a learned process that occurs as the result of an animal feeling ill or nauseous after eating food, and quickly learns to avoid that food. This phenomenon is an evolutionarily conserved trait that is shared across multiple species and teaches an animal to avoid a food that may have made it feel sick and similar foods like it in the future. Food aversion can be learned after a single event and can develop even if the ill feeling or nausea occurs hours after eating the food. It can also develop whether or not the food was the cause of the ill feeling. There are many situations in which food aversion is encountered, but perhaps the most relevant situation in both human and veterinary medicine is the development of food aversion during illness. An example would be someone developing a taste aversion to ginger ale when they were feeling sick. Ginger has been shown to reduce the feeling of nausea in humans. But what could happen instead is that an association may develop between the taste of ginger to the feeling of being sick, leading to the person developing an avoidance of ginger for a very long time. For companion veterinary patients, food aversion can occur when the dog or cat is fed a diet, particularly if it's a new diet, during a time when they are in pain, ill, or nauseous. This can be compounded if the dog or cat is also in a strange environment, like in the clinic. In this situation, they may quickly learn that the food is making them feel sick, even when it isn't the case. And then they will avoid eating that food from then on. Since food aversion is a strong learned behavior that is difficult to extinguish, the best thing to do is to avoid the development of food aversion to begin with. To do this, it's important to effectively manage any pain and nausea and introduce new foods gradually in a familiar environment. In general, the ideal diet to offer to hospitalized patients are the ones that are the most similar to the diets that the patient is eating at home. This will not only help with acceptance of the diet in the clinic, but may also help avoid any gastrointestinal side effects that can occur due to a sudden diet change. This is one reason why taking a proper dietary history is so important for each patient, as it can help guide us to decide which available diet we have in the hospital is actually closest to what the dog or cat eats normally at home. For patients who have a disease or condition where feeding a veterinary diet is important therapeutically for them, it is recommended that those diets are introduced only after any pain or nausea is effectively managed, and ideally when the patient is at home and comfortable. Always remember to gradually transition them onto the new diet as well. A new diet, particularly one that is important therapeutically to a dog or cat, should never be introduced in the hospital. There are very few instances where it is dire for a therapeutic diet to be started immediately. Instead, that patient should be fed a complete and balanced diet appropriate for their life stage and be gradually introduced to the therapeutic diet at home. It is not recommended for therapeutic diets to be blended and used in feeding tubes in the clinic because it often requires a lot of water to create the correct consistency. This will affect the nutrient density of the diet and may make it difficult to meet the patient's energy requirements. Also, there is a risk that some of the food might actually reflux back into the oral cavity, and a taste aversion could still develop. So in cases where feeding tubes, syringeable diets, veterinary therapeutic liquid diets, or supplemented human liquid diets formulated to meet the nutrient requirements of the patient should be used instead.